Hi, I'm Anthony and I'm a paramedic, and today I'm going to demonstrate to you how to carry out cardiopulmonary resuscitation on a patient. As always, before entering any scene, ensure that the scene is safe. Apply your standard infection control precautions, your gloves, and obviously in this case I will need a face guard, so a pocket face mask is suitable. Approach casually and always check for a level response. 2 hands on the shoulders. Hello, hello, can you hear me? If no response, shout, help, help. Can you ring me an ambulance, get me an AED and come back and let me know that ambulance is coming? Okay. Perform a head tilt chin lift onto the patient. Check the airway for any obstructions. If there's no obstructions, look, listen and feel for absent or inadequate breathing for no more than 10 seconds. Patient is not breathing, go straight into chest compressions. Landmark, center chest, heel of the hand onto the breastbone, interlock the 2 hands. Keep your shoulders over the midline of the body and keep your arms locked out. Compress the chest at least 5 to 6 centimeters at a ratio of 30 compressions to 2 breaths. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 12 40 50 60 70 80 20 21 22 23 24 27 28 29 30. Take out your pocket face mask. Hands off the chest, should be no more than 10 seconds. Give 2 breaths of around 1 second in duration. 6, 7, 8, 9, 10, 11, 12, 30, 40, 50, 80, 90, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30.
Hands on the way, there's the AED.
As soon as your AED comes, turn on your AED. If there's another bystander present, they can continue to carry out compressions. Expose the chest, checking for pendants, patches, pacemakers, perspiration, Playtech, any excessive hair. Look at the pictures and apply pads accordingly. To the middle shoulder, or mid clavicle region, and the mid axillary region, which is under the armpit. Plug in your AED.
Analyzing heart rhythm.
Stand back from the patient, shuffle back.
The patient.
Ensure no one else is touching the patient. It's analysing the heart rhythm.
Shock advised.
Shocking now, stand clear.
Stay clear of patient. Delivered. Shock delivered.
Shock delivered. Continue chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. One, 2, 3, 4. CPR is continued until the patient becomes responsive or the patient starts to breathe again, or someone more qualified comes and takes over. If the patient starts to breathe again, you need to assess the patient's breathing rate, the The patient must be breathing greater than 10 breaths in a minute and less than 30. If the patient is not breathing between 10 and 30 breaths, we must provide emergency breathing for the patient. If the patient is breathing sufficiently to sustain life, we now place the patient into the recovery position.